international institutions represented here today of UN Habitat and WHO. I will briefly introduce them in a moment as they are keynote speakers. We also have senior officials from municipal and regional governments represented by the regional government of Catalonia in Spain, as well as the City of New York, the Commissioner of Health. And we also have a very established career urban planner and professor who is with us today from China, with us at a 12-hour time difference. And he is the Secretary General of the Urban Planning Society of China. I will reintroduce each of these individuals at a later date, but I would like us, in the interest of time, and as I try to make my own direct connection with this, with the technicians, I would like to ask that the two keynote addresses begin. The first keynote will be made by the Executive Director and Undersecretary General of UN Habitat, Maimouna Sharif, who herself is a 20-year career urban planner and then went on to serve as mayor of Penang. So she brings a lot to this discussion and dealt with public health issues continuously in her last 30-year career. We also have, and I'm pleased to welcome Dr. Naoko Yamamoto, who is the Assistant Director General of the World Health Organization. Her responsibilities are to oversee universal health coverage and the healthier population initiatives of the World Health Organization. She is a epidemiologist as well as a medical doctor and has a master's degree in public health. She is the former Senior Assistant Minister of Global Health of the Ministry of Health of Japan. I'm very pleased that these two women will be joining us as opening panelists. And I would like, through this link, to request the Executive Director and Undersecretary General, Maimouna Sharif, if you could please begin. Thank you very much, Madam.
Thank you very much, Chris, and Excellencies, distinguished delegates, friends, ladies and gentlemen. A very good morning, good afternoon, and evening to all of you. Can you hear me well? I'm pleased to be here with you on the occasion of the high-level political forum. I would like to thank the organizing committee for hosting this event, bringing together the member states and leaders from around the world to discuss and define strategies to bolster action to realize the decade of action and delivery for sustainable development. The world is living through unprecedented crisis as COVID-19 continues to spread. We're supposed to meet in New York now, but we are now struggling with this new normal and also with the new technology. So with this, COVID-19 continues to spread with tens of thousands of lives lost and over 200 countries affected. In just a few months, the pandemic has transformed the way we live, the way we work, travel, and socialize. Cities are at the front line of the pandemic. Local governments react quickly to this urban humanitarian crisis to protect their citizens and to make cities more resilient. And they are also using the recovery process to bring all citizens together, adopting a whole of society response with a renewed appreciation for multilateral cooperation. UN Habitat and World Health Organization have a long-lasting and ongoing collaboration regarding urban health. Together, we provide guidance and inspiration to the member states to build better urban environments that promote health and well-being. The SDGs allows for numerous linkages between health and sustainable urbanization. SDG 11 and SDG 3 need to work in synergy to provide the basis for healthy cities. Last month, we launched a joint publication with World Health Organization on integrating health in urban and territorial planning. It is a source book that demonstrates how urban planning and design need to adopt health consideration when shaping the urban landscape. This collaboration is proving its worth during COVID-19. This epidemic is most devastating in poor and densely populated urban areas. Population living in overcrowded housing, in slum and favelas are also essential frontline workers who keep our cities functioning. The economic downturn is impacting these vulnerable communities as much as the health cost of COVID-19. We found that density with diversity of users provides support for communities to endure lockdowns better. But public spaces have proven to be a lifeline for many and a vital resource for the delivery of emergency services and support. Yet, we know the debate is not concluded. Policies will need to be shaped and long-term strategies need to be defined. These guiding principles need to promote equity with a continued focus on climate change and multiple risks it poses to our world and cities. At UN Habitat, we are collecting data and evidence to help us better understand all these trends and implications. We must collaborate with all stakeholders so that data from community, city, regional, and national levels could be integrated, analyzed, and used effectively. Currently, UN Habitat is working towards a report titled The Future State of Cities in a World with Pandemic, which will identify key strategic areas of sustainable urbanization and discuss the most significant impact of COVID-19. The report is focusing on 4 key areas. Number 1, governance and the reshaping of state and the pandemic brings into focus. Number 2, the situation of inequality and poverty which emerged from this crisis. Number 3, the local economic business model in face of the crisis. And finally, the relationship between urban form and health, which is the focus of this session today, as we must think through the issues of density, overcrowding, public space, and health. The report aims to frame and rethink urban morphology and typologies, creating new evidence on densities and compactness. It seeks to identify the aspects of urban form that can mitigate the spread of future pandemics, reduce the adverse economic impact, protect the vulnerables, build resilience in the face of pandemics, and achieve sustainable cities from socio-economic and environmental perspective. Please let me welcome our panelists today and thank them for sharing their perspective so that we can better understand the future of our cities. Let me also recall our commitment to this decade of action towards SDG 2030 and redouble our effort to using the new urban agenda as our collective tool to achieve sustainable urbanization. The path is long, but I am sure with your commitment, we will build back better together. And for this reason, health has been set as a cornerstone of the new urban agenda and our strategic plan 2020 and 2023 to ensure that urbanization become a catalyzer of good health and well-being, and inversely to make health a key driver of sustainable development. Thank you very much for all of you for being here. I wish you a robust discussion, and I look forward to hearing your perspective and how to build back better and how to build back greener together. Thank you very much. Over to you, Chris. Thank you.
Can you hear me now?
Yes, Chris.
Okay, thank you very much. It's my pleasure. Thank you. First of all, thank you, Undersecretary General and Executive Director Maimouna Sharif, for your introductory remarks. I'm very grateful for that. I'd like now to turn to Dr. Yamamoto, if you could, from the World Health Organization, if you could please proceed with your keynote address. Thank you.
Thank you, Chris, and excellent distinguished delegates, colleagues, ladies and gentlemen. It's my great pleasure to talk with you today from Geneva on this very important, timely event. I would like to thank High-Level Political Forum Organizing Committee for enabling this discussion and all partners, all speakers involved in making this event happen. I would also like to thank you everyone that now listen to us and follow this event closely. The COVID-19 pandemic
Watch out, we cannot hear Miss Yamamoto right now.
Naoka, you have muted yourself.
I did. Can you hear me?
Now we can hear you. Please proceed.
Oh, okay. I'm sorry. Do I have to start from the beginning? It means. Okay,
Please.
let me start. Thank you very much. Sorry about that, but Excellency and distinguished delegates and colleagues, ladies and gentlemen, it's my great pleasure to join this event today from Geneva. I also would like to thank the organizer to have this meeting, and also I would like to thank everyone who now listen to us. The COVID-19 pandemic has hit a time when sustainable urbanization is increasingly seen as a transformative force, a force that can accelerate progress toward the healthier, greener, safer, more inclusive, and resilient future set out the SDGs. Cities not only an engine of global innovation and economic growth, but also the linchpin to addressing inequity and ensuring sustainability. Local and regional government have a fundamental role in fighting COVID-19 while driving the achievement of the SDGs and overcoming global challenges such as environment degradation and climate change. COVID-19 has also served as a wake-up call for some and a reminder for many others of the importance of the urban forms for health. The urban forms define the air we breathe, quality of spaces we use, and water we drink, the way we move, our access to food, and access to healthcare for all. The inextricable link between health equity, and urban environment will affect our capacity to prepare for, respond to, and recover from COVID-19 and other pandemics. Given its impact on many upstream determinants of health, it will also decisively contribute for our mission to promote health, keep world safe, and save vulnerable. This is by no means a lonely exercise, but a collective global effort with many minds, hearts, and hands. The World Health Organization, WHO, is proud of the very fruitful partnership of decades with UN Habitat on issues related to health and urbanization in support for member states and cities to incorporate health and well-being into urban planning and development. As mentioned by my colleagues, Madam Maimouna Sharif, the launch of our latest joint publication on integrating health in urban and territorial planning demonstrate our collective efforts to help shape urban environment that are safe, health, and promoting health equity and well-being. This understanding has never been so important, the wake of WHO COVID-19 crisis, because many urban areas have accumulated large-scale of chronic vulnerabilities due to natural and man-made hazards and long-term stresses. Repeated shock and large-scale urban disruption have also undermined cities' resilience. The risk of disease such as COVID-19 taking a foothold in fragile setting is very real and puts the entire world at risk. Many people are unable to work from the home due to the nature of their work or lack of connectivity and digital tools, which will also affect education, making those groups and areas even more vulnerable to COVID-19 exposure and its socioeconomic impact. Urban poor in underserved, informal settlements and slums, migrants, indigenous peoples, and those in informal housing or work are also often hardest hit. At the same time, COVID-19 is contributing to change our cities, as happened in the wake of the global flu pandemic back in 1990 and the localized epidemics of tuberculosis or cholera. These events drive the introduction of sewage system, public parks, and housing regulation to improve sanitation and reduce overcrowding. The pandemic of this generation is accelerating trends such as digitalization, shift to remote work, and reclaiming streets to cycling and walking, showing that society is capable of overnight transformation. We, the world cities, change and transform a broader health lens to COVID-19 responses and recovery can help ensure we leave no one and no place behind by tackling structural inequities, including poverty, gender discrimination, giving voice to the vulnerable and marginalized, and promoting solidarity. WHO recently released the manifesto for healthy recovery from green and healthy recovery from COVID-19. It highlights that we can either lock in economic development patterns that will do permanent escalating damage of the ecological system, or we can wisely promote healthier, fair, and greener world. It presents 6 prescriptions. First, protect and preserve nature. Second, invest essential services from water and sanitation to clean energy in the healthcare facilities. Third, ensure quick, healthy energy transition. Fourth, promote healthy, sustainable food systems. Fifth, build healthy, livable cities. And sixth, stop using taxpayers' money to fund pollution. This event presents itself a unique opportunity to gather many lessons, experiences from our distinctive speakers and attendees to pave our collective path and deliver on a healthier and more resilient society. WHO strongly believes that cities can be champions for the green, healthy, and prosperous society for the future, from the immediate response to COVID-19 to the achievement of SDG and climate change agendas. We welcome mayors and local authorities and all urban leaders to embark to this journey of healthier future from COVID-19. On behalf of WHO, I would like to thank you for participating in this important gathering. I wish us all a productive and successful meeting. I thank you. Back to you. Thank you very much.
Again, thank you, Dr. Sharif, for your contributions. I'm grateful that UN Habitat and WHO are able to join forces not only in this event, but as was mentioned, in a number of joint initiatives to not only respond to the COVID response, but also to deepen conversations, policies, and programmatic work that can help member states look more seriously at the linkage between urban planning, layout, design, et cetera, and public health. With these 2 interventions, I wanted now to turn to our panelists, of which I had mentioned before there are 3. I will mention once again their names, and then I will ask a set of questions that I'd like them to consider as we begin this discussion. The first speaker will be Damia Calvet, who is the Counselor of Territory and Sustainability of the Regional Government of Catalonia in Spain. And as I had mentioned before, he has a rich combination of academic, private sector, and public service that he brings to this discussion, both as an engineer and planner, but also as a private sector realtor, developer, real estate developer, and a prominent member of the political scene in Catalonia. So with his interventions, we'll certainly get a feel for Spain, which was very much hard hit by the COVID and still is challenged by the recovery. We'll also turn to Dr. Oxiris Barbo, who is the Commissioner of Health of the City of New York. And she's a medical doctor with extensive experience, not only in New York, but also in Washington, D.C. and Baltimore. She, like the counselor from Catalonia, has really been in the epicenter of this crisis. And it's just a pleasure and honor to have her with us today to share some of her reflections on this important issue. Lastly, we have the Professor Sri Nan, the Secretary General of the Urban Planning Society of China, also extremely experienced, over 30 years in academia and as a professional master planner and policy analyst. He brings a significant set of experiences to this discussion. And like Spain and New York City, China certainly dealt squarely with the pandemic, both the initial outbreak and its efforts to recover. So we have really three people who have extensive experience on this issue and are from places where the pandemic has been extreme. So I look forward to getting more ideas and perspectives from them. The set of questions I would like to direct to each of you is twofold. One concerns the issue of density and overcrowding and its relationship to public health. And the second, the issue of public spaces and whether that constitutes an asset that's helpful for cities for the population, not only during COVID-19, but in general in terms of improving livelihood, socioeconomic, cultural exchange, as well as economic development. So these are two broad questions, one on density and overcrowding, its connection to the resilience of cities, and secondly on public spaces. So without further ado, I would like to begin with the Honorable Councillor, Damia Calvert. I appreciate that there will be a interpretation of his statement, so if we can hear that in Spanish, those that do not speak Spanish, we'll be patient and there'll be a brief interpretation of his presentation by one of his colleagues. So over to you, Honorable Councillor. Thank you.
Thank you, Mr. Williams. I think that I will speak in English, so it will be easy for everybody to follow my intervention. Thank you for letting us participating in this high-level political forum. It's always an honor to be in a forum organized by United Nations, by UN Habitat. Ms. Sharif and Ms. Yamamoto, you have explained to us very encouraging words. And yes, I would like to make this approach to the relationship between health and the city, which is an everlasting one. Despite the fact that cities suffer the most when a health emergency strikes, the lessons learned during the outbreak do deliver permanent changes that they will alter the way we conceive the urban model. I believe that the coronavirus, the pandemic of coronavirus, will trigger a similar effect, especially in times of urgent need for action in cities. Urbanism has always had a health vocation, in fact. Great urbanists such as Jacobs, Haussmann, or Cerdà, he was from Barcelona, and he organized the city in terms of health, pioneered on conceiving a different kind of city and emphasizing the need for density, while assuring minimum hygienic conditions. While today this remains fully valid, we need to conceive the city embedded in a wider concept of challenges such as urban governance, of course, biodiversity loss, or the climate emergency. A health crisis, like the one that we're having right now, should not prompt an urban exodus wave, but rather a bold urban resilience wave. This is a very important concept. Cities of all sizes do and will remain as the main living spaces for humanity to thrive. So we should embrace them in a renewed momentum that puts sustainability and resilience at its core. We must plan towards a territorially aware network of dense, well-planned cities in close contact with their respective hinterlands. Of course, this is very important. Envisioning a territory where opportunities can be found everywhere. The coronavirus pandemic obliges us to readapt once again. We have been readapting cities throughout the history, but once again, we have to readapt the way we conceive this urban public space. Health and resilience gain preeminence in this emerging context as the population perceive more risks, often associated with the urban form. In this light, while urban density is part of the health problem, it is indeed part of the health problem. It plays also a central part in the solution of other major crises that threaten our health, such as poor air quality, heat waves, or plastic pollution. All of them related with climate, with the climate crisis. Density is key in reshaping cities to put people at its center. As shorter trip distances allow individual sustainable means of transport, thus reducing car dependency. My country, Catalonia, has embraced the global urban momentum against COVID-19, along with Barcelona, the municipality of Barcelona, and other interior cities and towns. We have also restricted car space to devolve this space to the pedestrian in an attempt to slow the spread of the virus while strengthening the right to the city for its neighbors. We could say that this crisis has reinforced our commitment with the new urban agenda. We are developing the new urban agenda through our own Catalan urban agenda, and the crisis has reinforced our commitment with this as a key tool to develop these more resilient cities. Density, both thought as part of the problem, but the solution, I would say the solution, of course, well related with the hinterland, for other crises that we have to deal with as the climate crisis. So in conclusion, these are times of great suffering, of course, but we must endure, and now more than ever, be ready to be resilient. When the pandemic finally remits, we must consolidate the lessons learned, creating plans, green and urban agendas that embrace a new urban culture that puts people and planetary health as its first and not most important priority. This is what we're doing right now in the Catalan government. We're preparing this plan for recovering economy and to preserve all the social policies, the social protection, and the urban agenda is at this high position as the way that we will define how this territory has to be in order to be a more prepared society, a more resilient society. Thank you, Mr. Williams.
That your English was that good. I would have planned myself very differently for this meeting. Thank you so much. I'm grateful for your bilingual capabilities today. It's great.
Thank you.
But more importantly, I'm very pleased with the spirit of your contribution, and it very much preempts future questions in this session concerning the need to readapt. And I really appreciate the importance of a urban resilience wave and what that means, particularly for the new urban agenda. So thank you. I now turn to the City of New York. And again, it's a pleasure to have the Commissioner of Health here. Dr. Oxiris Barbo, the floor is yours. Again, the two questions. Thank you.
Thank you very much. So I think what I'll do is I'll frame my remarks about density and public spaces from the perspective of our experience here with regards to the infectious disease component of COVID-19, but also with regards to the mental health impact of the interventions that we've put in place in order to mitigate the spread. And so from an infectious disease point of view, what we have experienced here, I think, is similar to what's being experienced in other parts of the world, in that we see high levels of transmission in parts of the city that have high concentration of overcrowded housing, as well as high concentration of essential workers, frontline workers. And that in our response to reducing transmission, we have had to really account for the importance of housing in this regard. And initially, you know, our housing intervention was focused on providing safe havens, if you will, for healthcare workers to prevent them from potentially transmitting the illness to their loved ones. But very quickly, that evolved to providing housing for individuals who were being discharged from the hospital so that, again, they can continue their convalescence and open up capacity in healthcare facilities. And we were able to repurpose, if you will, hotel space that had been going unused in order to accommodate that capacity. And additionally, we were able to deploy public spaces in order to stand up field hospitals, if you will. We were able to do that in various parts of the city in anticipation of accommodating increasing capacity needs in hospitals. Thankfully, we are now at a point where we have bent the curve in terms of the number of new cases that we are seeing on a daily basis. As compared to thousands of people being diagnosed every day, we're now down to anywhere from 200 to 500 people a day. And so we are repurposing those hotel rooms so that now, as we newly identify individuals in the community who are not sick enough to be in the hospital, we then assess their capacity to safely isolate at home. And if they are living in overcrowded conditions, giving them and their families the opportunity for either them to take advantage of these hotels that we have situated in various parts of the city to make it easy for people to take advantage of them, or for their loved ones to remain in the hotels while the individual who has COVID convalesces at home through the 14-day or the 10-day period. Additionally, what we have done through the use of our data has been to identify households that are multi-generational households, because that is, in addition to overcrowded housing, another high-risk setting where transmission could result in especially bad outcomes when, for example, a young person transmits to an elderly person in the home. So we are now transitioning more and more to this model, and we are going to be focusing on intensifying our testing opportunities in zip codes where there's an overlay of overcrowded housing, there's an overlay of remaining high positive cases, to again address the issue of interrupting transmission and allowing for the safe housing during the isolation period. I will say that as we are transitioning out of in essence, total lockdown of the city, one of the ways in which public spaces, I think, are being utilized is to really help with the mental health implications of people having to isolate at home for so long. Our city has been really in a position of lockdown, if you will, for roughly 3 months, and the isolation that happens with that, I think, has been exacerbated when we overlay communities that are isolated from access to technology, and utilizing public spaces that allow for at least 6 feet of distancing while using face coverings is a way in which we are now really moving towards as the city emerges from a what we call New York State pause. The other thing that I will add is while that presents us with opportunities to have people interact with people beyond their immediate families, obviously it presents challenges in ensuring that New Yorkers don't go back to quote unquote life as it was pre-COVID prematurely. So that is something that we are acutely mindful of, and we're seeing it as a balance between providing outlets that contribute to people's positive mental health and ongoing connections, while at the same time not leading to a resurgence. The other thing I will say that as we emerge more fully and as we think about building it back, I think the importance of assessing the distribution of public spaces in communities that have been hard hit will be important, especially as we plan for potential concomitant events. So for example, right now we're planning for potential heat events and what it means to have a heat event where we would previously have people congregate in what we call cooling centers, and we can't do that now. And so the importance of ensuring sufficient green spaces to reduce heat islands and the potential for heat events as a result, I think is important for us as we think through the future post-COVID and how we really look at the urban form and how it contributes to both physical as well as mental health. So I'll stop there and then we can take questions later. Chris, you're on mute.
Sorry, let me change that. For this this really comprehensive perspective, weaving public housing and crowded housing generally, essential workers and their particular challenges in this virus, the mental health piece, which is often not talked about at all, and yet is emerging as quite serious issue, and then how to deal with future pandemics, particularly dealing the mixture of what will happen with extreme weather events and how you'll be able to manage that in the public space question. So in the short period of time that you had, you really covered a lot. Thank you. I appreciate that that intervention. I now turn to our third panelist, who will be giving us a perspective not of New York and of Spain, but of China. So Professor Srinan, if I can turn it over to you. Thank you.
Thank you, Chris. Thank you very much. Thank you, Amara, UN Habitat, and also WHO. It's my honor to be join this discussion, and it's exactly the timing discussion on COVID-19 and also on planning issues. Not surprised to me as a planner that density issue is one of the debated factors among these all these factors. I do have a small presentation. I will focus on the density. Leon, would you mind I share my screen with the audience? Can I? We did a primary study on density issues in China at a different scale, from the national to the regional, and also within the cities with different density, and also with statistics of the COVID-19 patients. Did you see my screen?
We cannot see a screen.
We can't see it yet. We're working on it. Pamela's trying to load that up. So if you could just continue, then here we go. Seems we have some technical issues with the bandwidth the content that.
Can you see my screen?
Unfortunately not, because of the bandwidth issue they're trying to.
I think it's charging, but I can share it. I will share the screen.
Hello.
Yes, we can hear you, but your screen is not being shared.
Gosh. Hello, Leon, can you hear me? Seems I've lost connection with.
Yes, I think you should continue verbally as we try to get this document up. I apologize for the difficulty. It seems that the bandwidth is too low to make the connection. Sorry about that. But we can hear you. We can hear you and see you. Oh, congratulations. Thank you. I can see it on my screen. Please continue, Professor. Srinan, if you can hear me, we cannot hear you. Please, if you could continue.
Hey, can you hear me?
We can hear you now. Yes, please go ahead.
Okay. I'm sorry. It seems to be have technical problem with connection, and I will go very fastly. So we did a very preliminary study on density and also with the distribution of the COVID-19 cases in China. From this map, so you can see the map, did you? Hi, hello. Can you?
Yes, we can see it. Thank you. We got it.
Okay, thank you very much. Thank you very much. To your left is the distribution of the COVID-19 cases in the whole country in China, and you can see most of the cases are concentrated in Wuhan and the surrounding cities in Hubei provinces. But to your right, you will find that the population density map of China and the population are more densely distributed in the coast area, particularly in the lower reach of Yangtze River and the Pearl River, the Pearl Delta, Yangtze Delta, and also the Yellow River Delta. So you can see the overlap of these two distributions. And also this is some kind of historical evolution of the distribution of the confirmed cases in China. But if you look at this one, and this is a migration map of the eastern part of China, you will see a very interesting phenomenon that Wuhan is here right at the center and with a very strong connection with Shanghai, Beijing, and Guangzhou, and also with Chengdu. So Wuhan is right in the center of this kind of a diamond, and it's a sort of overlap with the distribution of the COVID-19 cases. So my first conclusion was suggest that there's no direct correlation between population density and with COVID-19 cases, but there is a relationship between these cases and the migration. So the intensity here, I would suggest to use a term of the intensity of connections between cities, between provinces, and between communities will be important factor. And also we look at the city scale, and we analyze the 300 major cities in China, and also we categorize them into 3 groups. The first group with only less than 100 cases, and the second group with 100 to 1,000 confirmed cases. And the last group is cities with more than 1,000 confirmed cases. So from these 3 chart, you can't see any relationship between densities as a horizontal axis and with confirmed case as a vertical case. And also you can see very interesting phenomena here. And on the top of the chart, you will see cities, 2 cities, and also this is Beijing, by the way. They have a very low, relatively low density, but with a higher number of confirmed cases. And also we look at the highest density cities in the country. And if we do find a very interesting phenomenon that some cities like Shanghai here, and like city of Guangzhou, and also like city of Tianjin, they have a number of confirmed cases sort of in proportional to the density. But other cities, there are other cities like Shenzhen has an extremely high density, but with a moderate number of COVID-19 cases. And in the case of Beijing, the density are relatively low, but the confirmed cases are pretty high. So at the regional level, and we have the similar conclusion, but we suggest that the physical distance and also the way of communication will be very important to have some kind of impact on the spread of the epidemic. And also if we look into the inside structure of the city, and we try to analyze as many as of the cities, here I will present you 3 cities, Shenzhen and Shanghai and Beijing. A general conclusion is that there's no relationship between density and the case of the confirmed cases. But we do find some interesting cases, phenomena here. In Shanghai, the old part of the city, Jing'an district, Huangpu district, and Hongkou district, they are all the oldest urban district on the bound. They have a very relatively high density, but with a low confirmed case. And the similar situation here in Beijing, you will see the city center area, Dongqing and Xiqing district, high density, but with lower COVID-19 cases. So, and also, if you look at this map, it's also interesting. And to your left is the employment density of the whole city. And you can see the employment center here, the CBD area, and also the financial district, and also the high-tech district. So this is the center of the employment, and also means the center of the population, the density. But if you look at the map of the distribution of the COVID-19 cases, particularly at this time, and the high-risk area is around here. And also this blue part, it suggests to be the middle risk area. So it's also has no relationship with population density. So we suggest that at the municipal level, the social awareness, social participants, and also the community governance will be important to prevent the spread of the epidemic. And there's also no evidence to suggest the relationship between density and COVID-19. So if we look at this chart, I try to figure out the relationship. So look at this chart, you will see the city provide more opportunity and chance. And then we have the accumulation effect, the economic scale, and then it will increase the density of the city. And then we have, which means intensity of context, either at the regional level or within the city inner part. And behind that is the economic efficiency, sustainable environmental sustainability, and the social equity. If you prefer higher density, and you will on the cost of the environment sustainability, although it could increase the efficiency. So the main issue is to maintain adequate level of compactness or the density of the city and better connected places. So this is my main argument that the planning, what can planners do is to help the city to maintain this kind of adequate level of compactness. As for the public space, I would say it has a merit of the social inclusion, and either general park or the open spaces or the indoor facilities like stadium, and the well-designed open space will provide the equal access to everyone, for all, either the different economic background or for the vulnerable peoples, they could have the equal access. So this is one of the I would say that the urban spirit for social inclusion. And also it's at this pandemic, we do find another important function that the public space could provide a temporary space to accumulate the shelter for the mild patient, and to mitigate the pressure to the hospital. So as a well-designed and also equally distributed open space in the city, and it also will provide different functions or different purpose to cater the different demands of the citizen. So this is why we encourage all the cities in China to provide as many as possible open space, and to all the citizens, either the local residents or the migrants, to enjoy the amenity of the city. And I will stop here, and thank you very much.
Thank you very much. I'm very pleased that once again, like the previous speakers, you were able to share a tremendous amount of information in a short period of time. This is proving to be a very content-rich dialogue. And I'm particularly pleased with the way that you have unpacked the issue of the relationship between density and disease transmission, number of cases, both in terms of unitive analysis, looking at the entire country, looking at a city, looking at a part of a city, a neighborhood, but also trying to look at, if there are no direct correlation, what are the other factors that are contributing to it? And I think this links very closely with the other presentations, because what we're seeing in the New York context is that it's not just a question of density, it's also place of work. What are the people that are living in these particular areas doing as their occupation, and is that as much a factor of their ability to transmit the disease as where they live? So place of work, place of residence, important distinctions. And then, as we heard from Spain, we're really talking about a different way of designing cities so that they accommodate some of the issues, not only of density and crowding, but also workspace relations. So I think there's a lot of rich content here. There have been a number of questions that have come up in the chat. And so in the interest of time, because we had a bit of a late start, and I apologize for that, technical difficulties, I'd like to weave another round of comments from the panelists and also extend that to both of the keynote addressers. I believe they're both still on the line, or those who were there, with a view to be sort of forward-looking. Where are we going with this? What are the takeaways? If you could make a suggestion about how we build back better. We use that rhetoric very much in the United Nations system, and I think in many governments and cities around the world. If we're to learn from this experience and address what it has made visible, what it has shown in terms of design issues, inequality, mobility, place of work, place of residence, what are some things that we can do? And some of the chats have kind of spoken in this.
Okay, sasa imefika. You know how to reclaim it?
So sorry. So some of the chats that we've questions on the chat. If someone's on the line, if they could mute, please. Thank you. One of the questions on the line was, do you envision a very different design for cities moving forward? Will there be a new design that we see? And
yes,
second
I know, don't worry.
Hello, if someone is on the line, please mute. Thank you. If Leon can unmute, or Pamela unmute those people, thank you. And the second question is, what kind of capacity do cities have to make these changes, both to deal with the immediate response, but also to build back better? Are they financially set up? Are they autonomous enough from central governments? Are they in a position to take the kind of decisions and innovations moving forward if they have those ideas? So these are some broad questions that have come up through the chat. And one last question, looking at the relationship between municipal governments and civil society or non-state actors, what kind of partnerships between these groups have contributed to how we can build back better? So with these sort of reference to the chats and the forward-looking, if we could have just in a few minutes from each panelist a quick reaction to where we should move forward. I'm seeing on the line that despite being at 1 in the morning in Malaysia, our executive director has kindly stayed on. Maimuna Sharif, thank you so much for your commitment to this. If you had some brief remarks that are forward-looking, thank you very much.
Thank you very much, Chris. That I really enjoyed the conversation, the feedback, and the presentation. That the perception between density versus intensity and versus overcrowding. I think this is very, very important for us to understand. It's not only to put the blame on density. There are also many other connecting matters that connect to the issues of pandemic. If it's high density, what with very spacious public space, and with good governance and communication, I think will also helps in mitigate the spread of the pandemic that is shown, for example, in China. I think we need an integrated approach, not only to look at the density as one factor for the pandemic, for the COVID-19. I think we'll need to really look into the more detail, and I think the more research have to be done, and I'm very, very happy to see the research done from our colleague in China. I think that shows that we need an integrated and holistic sustainable development plan, linking into the housing, public spaces, health, and communication, and also place of work. So I think it's to provide the more, I used to think that more cleaner, greener, safer, healthier. At the end of the day, we have a happier people living in the city. Over to you, Chris. Thank you.
Thank you very much. I couldn't agree more. It's very encouraging to see us unpack an issue that is often simplified in the media and even in our conversations with one another. And it's really encouraging to hear messages that come from these different hotspots, areas of the world where the pandemic has been very strong, and understand that it is a more complicated story, but that the right combination of factors, when brought together, can contribute to the situation moving forward. I understand that some colleagues have to move and connect with other places, so I'd like to shift to Spain again, and if we can have the Honorable Councillor Damia Calvert, if you could give your brief comments on way forward. Thank you.
Thank you. Just a brief comment, because as you have said, I have to leave. We have now another meeting. I have to admit that I'm very impressed by the presentation of Mr. Nanshi. I have to admit that I have been taking pictures of his papers, because the difference between the density of contacts and density is crucial to understand why in some environments the disease has spread more faster than in many others. But at the end, what we need to have is the cities have to be planned according to this health issue. This is something that we were not facing. We were facing the climate crisis, the mobility crisis, creating cities inclusive. But now we have to introduce this health, not just let's say the well-being, the health issue inside the planning of our cities. And I'm part of a subnational government, which is a specific position between states and cities, and we are responsible for key issues like mobility or urbanism or public housing. So what I want to underline is this key position for regions, for subnational governments, in order to create environments for the cities to have the right planification. Our position is to reinforce the tool of the new urban agenda as a way to introduce all the issues that we already have, that now we have to take into account the health issue too. This is something that we want to do. We are committed to do it, and that this position of subnational governments be, let's say, considered by United Nations system in order to help to have a better world. Thank you.
Sorry, I'm just jumping button. If that's all. Thank you. Well, thank you very much, and I really appreciate your contribution to this panel. And once again, it's a pleasure to have the perspective from Catalonia and your personal involvement. So we look forward to working with you in future to continue this conversation. With that, I'd like to shift to New York. Dr. Barbeau, if you could give me your quick thoughts on sort of moving forward. I think you hinted at many of these in your comments earlier, but I was sort of challenged by one of the chat questions, and maybe this is very relevant for New York. Can we move New York in a different direction in light of all of this? You mentioned the hotspots, and that's just one piece of it. But do we have enough public space? Do we have public space in the right areas? Do we have really a longer-term challenge to take this extraordinary innovation that New York has done by using vacant hotels and placing people? Can we deal with the housing crisis? Can we move in this direction? Can we leverage this moment? Perhaps I'm too aspirational, but I challenge you to think in those directions. Thank you. Look serious if you're on mute. Seems we've lost her on the line. I'd like to shift my question then back to Professor Shinan. If you could give us your thoughts based on that analysis, where do we go from here?
Okay, we do learn a lot from the lessons of this pandemic. My society has been working very hard with our members and also with local planning authorities to try to reshape the planning in the country. And one of the basic starting point will be to have a more, as Mamura has mentioned, a more integrated consideration of all the factors, but particular attention to the nature. We try to looking for a more environment friendly and aware of the urban growth, and we try to find a nature-based solution, and we try to learn from our history, the ancient Chinese wisdom, how to deal with the relationship between human being and the motherland. So I don't think that the density will take the blame, and also I don't think the city will take the blame. And the city is of course, city is a concentration of the majority of the cases, but the city to some extent is a victim of the pandemic. And also city is a center for the public service, and also city is a center for all these opportunities. So a well-planned city, which is highly respected to the nature, and also addressing the global challenge, and will be the home for all the citizens. And also, I would to add one point that health is not only health. Health is an issue of the urban equity. It's an issue of the integrated urban well-being. So health is one of the factors the urban development have to confront with. So when we're doing the planning, health have to be emphasized, have to be addressed. And it's, of course, it's a kind of provision of the public service, but it's different from other services. It's a fundamental, I would say, the threshold for the quality of life. So we suggest our members by reshaping our thinking about what is a good planning should be, and how to deal with our environment, because many of the diseases are actually triggered by the environmental pollution and other problems. So many lessons we have been learned from this pandemic, and also we have starting our work on the new standards, norms to provide for as a toolkits to our members to reshaping the planning in the country. Thank you very much.
Thank you very much. And I want us to turn it. It seems we have Orixis back on. If we could speak with you, if you guys, maybe you heard my provocation to you, my aspirational provocation to you earlier. If I can turn it to you, please, and then we'll go quickly to Dr. Yamamoto at WHO. Thank you.
Yes, thank you, and I apologize for that. I had some technical issues. I couldn't unmute. But I think, you know, the question is a central one that we are grappling with now. And I think that moving forward, one of the fundamental things that we as a city, as a nation, as a world, I think we'll need to contend with is fundamental income inequality and the degree to which that then contributes to the kind of conditions that are making it harder to abate the spread of this virus. And so as we move forward in addressing the stage we are in now, one of the things that we are actively doing is engaging communities more meaningfully in what it is that they see from their perspective would be most beneficial at the local level to ensure that we support them in remaining in isolation quarantine, and that we support them with regards to food insecurity, housing insecurity, and the like. And you know, we, along with other cities in the United States, have, for example, suspended increasing rents for individuals during this time. And I think, you know, that leads me then to my final point, which is there are many things that we as a city, as a country, as a world have suspended during this pandemic. And I think that it's an opportunity for us to question why it is that we do certain things and to push ourselves to reimagine. So for example, you know, during this time, we have spent a lot more resources on telemedicine and providing access to care so that people don't have to come into a doctor's office. Well, I think we should think more about how we can finance that, how we can increase access. And even more fundamental than that, in the United States, I think, you know, this pandemic has demonstrated that millions of people have lost work because of the economic consequences of this pandemic. And I think it's time for us to really question why the United States still has employer-based health insurance. And it's an opportunity for us to think about what are the structural ways in which we can help support populations have better health.
Thanks very much. I like the reflection piece. I think that's very helpful. To take a step back and see what's happened, how we've adapted, and what implications that has for both our ability to respond to the crisis and future crises, but what it also means for greater efficiencies. And I also very much appreciate the tactic of really looking hard at the underlying inequalities that have made responding to this crisis so difficult. I think this crisis has made visible things that were in our society that we have not really confronted to the degree that this crisis has forced us to do so. So I welcome that. I realize it's not just late in Kuala Lumpur in Malaysia and Penang, but it's also late in Geneva, coming into dinner time, a late dinner at that. So Dr. Yamamoto, if you have any closing comments, we would be most welcome to hear those. Thank you.
Thank you very much. Can you hear me now?
Very much so, yes.
Okay, thank you very much, Chris, and thank you for allowing me to join. Let me very short, quickly, 3 points. One is health. I believe that during discussion, many people can agree that health creates some good platform to discuss about urban environment, also housing, and also urban city in the issues. Health is not only the physical health, but also including mental health and well-being. And I'm not talking only the COVID-19 or pandemic issues, but the health in the more broader way that we can discuss. And also health for people means health for children, health for elderly, health for handicapped people, and so on. So this is good. And also we should include the future generations' health as well. Second point is I really encourage the presentation with Spain or New York, and also some research from the Beijing and China, because local government and cities is as I said, that the core to create a new healthy environment, healthy and sustainable environment. And the people, second most important is participation with the people and empowerment people. So people can change the housing policy or people can change the parking or park or spaces. Many issues, people can do it and change it together with a good leader. Sad issues, but still, the New York leader said that how we can address inequity of health issues or inequity issues, how we can hear from the voice of the vulnerable, marginal people or who silent voices, and how we can create a solidarity in nation. In the case, as the Professor C. Nan showed that the data information is important to show the people the reality, and also we can do it. So thank you very much. I'm so encouraged to join this discussion. Over to you, Chris.
It's really, really helpful. And also from your perspective in WHO, very encouraging. And I like the fact that, both you and Sri Lan are asking us to think of health in a very different way, to look at it as environmental health, as well as individual health throughout the life course of an individual, not just in one station of life. And I think this kind of thinking is extremely important, as is the issue of not just addressing inequality with a set of policies, but also increasing the voice and agency of those most affected. Where are they in the decision-making process? I think this is quite key. There were many questions that came up in the chat, and I'm really encouraged. I think we had over 200 people who were on this chat, and I'm encouraged by that. And we will be putting up on this screen shortly, if we can manage it technically, an opportunity for you who are on the chat to contribute further thoughts, because your quick phrases, of course, were just a snapshot. There's much behind each of the comments that you made that I think would be important. This is a wider discussion that can only increase with importance over time. So please take note of what's put on the screen shortly that would allow for you to follow up and for us to consolidate that. WHO and UN Habitat will do a bit of an analysis on your comments and make that an outcome of this discussion, as well as the conversation that we've heard, very rich conversation among the panelists. I'd also, in closing, like to note that UN Habitat and WHO have put together a source book to look at what are some of the techniques for urban planning that can contribute to health, and especially in this wider sense that the Assistant Secretary General had mentioned. And I think this kind of information would be helpful to share, not only those who are panelists and on the chat, but also individuals who may want to take some of these issues further in their own work. From the chat, we had quite a few people, not just from the New York area, but globally, who were following the different panelists, and maybe they'd come from their networks, but also those that were curious with the issue and had seen it publicized. It's quite clear that this link that WHO and UN Habitat are looking at more seriously, which the pandemic has brought to the fore, between urban planning, urban design, density questions, and public health, can only grow with importance. So I'm pleased that this pandemic has essentially accelerated what we have been doing already with WHO, with UN Habitat. And I would like to emphasize, it's not an accident that we brought many of you from cities and regional governments. We feel that the local level is so crucial for addressing not just this pandemic, but dealing with the more structural underlying challenges that have been made visible by this pandemic. It's going to happen or not happen at the local level, and having regional government officials and public health commissioners on this call from different cities is got to be, I think, a good window into the type of engagements that institutions should be doing more moving forward. I just wanted to emphasize that UN Habitat and the World Health Organization are parts of a larger system of the United Nations, and we all work directly for member states in a General Assembly, and we are led by the Secretary General, who I would like to add is quite committed to building back better, but he's also, in so doing, interested in more effective multilateralism, and his vision of moving forward on multilateralism is not only to deal with the current challenges that multilateralism faces today, but also to make it more inclusive, to look at creative ways to bring in non-state actors, to work with local governments, to work with private industry, to be more effective in solving the world's problems, not only crises that like the pandemic has brought out, but the kind of urban future that is articulated in the new urban agenda. With these closing comments, I'd like to thank all the keynote speakers and panelists for taking the time in their different parts of the world and at different times of day. And I'd also like to take this opportunity to thank many colleagues that made this thing possible. Each of you who are panelists, there are a number of people who work with you who have been working with my colleagues to make sure that you're here and that the technology works, that you had an ability to contribute to the discussion. So I really want to wish a warm thanks to those supporters and the people behind the scenes that made this happen. A list too long to mention now, but I think I just want to recognize them. So with those closing remarks, thank you everyone, and please enjoy the rest of your day.
Thank you. Bye-bye.
Thank you. Thank you. Bye-bye. Yeah, thank you very much. Bye.